Hi everyone, I'm Gary Knoll. The question of heart disease that affects over 1 million people per year, arthritis, 35 million sufferers per year, and multiple sclerosis, and we don't have any accurate figures on that, is devastating. The only improvement has been in the area of heart disease, and that is not because of the medical model to treat heart disease. That comes through the individuals choosing a lifestyle that's more conducive to health. For instance, exercise, a proper diet, and stress management. With arthritis, well, you can have any one of several hundred anti-arthritic drugs. They do nothing to deal with the cause. They only help underlying symptoms such as pain. Well, there is a doctor in Hanover, Germany, who has had remarkable success. Some consider him one of the most brilliant scientific minds in the world. This man is considered the best expert that we could have on heart disease, and yet the FDA is not listening. The American Heart Association is not listening. Well, if they're not listening and they're not getting the message, the people in Germany are. But we feel this therapy should not be available just in Hanover, Germany, where he has his clinic. It should be available everywhere. And we're happy to have him on our program. Welcome to our program, Dr. Hans Neipert. Dr. Neipert, explain to us the nature of heart disease as you would treat it.
Well, I only treat heart disease where the heart muscle is involved or the coronary arteries in the heart muscle. I do not treat valve problems, for instance, or severe rheumatoid disease in the heart. So it's only a certain spectrum. What we do is we try to make the metabolism in the heart muscle, the entire chemistry, more resistant against lack of oxygen. So when there is a coronary disease, a clogging or a narrowing, that the heart muscle can survive more easily despite the lack of blood supply. And this can be done quite well. Was first shown by Hans Selye, a very reputed biochemist and researcher, many people know him, that just magnesium, for instance, is helpful to cure or to help survive such a cardiac necrosis, a destruction of the heart muscle in the test animal, for instance. Now, we developed in the late 50s so-called mineral carriers, where with the help of aspartic acid, of certain amino acids, where we carry magnesium or potassium inside of the heart muscle cell, and this definitely works like a new spark plug in an old motor, so the heart muscle survives better. This was 30 years ago, and still we do this today. This is now widely accepted in Germany and other countries also. In the meantime, 10, 15 years later, we connected magnesium to orotic acid, which comes from whey, from the milk. And this transports even better magnesium and potassium into the cell, and even better spark plugs come to the heart muscle. This is one way. Another way is that we try to clean the coronary arteries. You see, you have very often, you hear this here, coronary surgery, or now balloon, expanding balloon, which opens the narrowings, or a laser, or a rotating knife, many things. But the most elegant way is to clean the vessels from the inside with the help of certain enzymes which just digest away the layers, or the early thrombosis, or coagulants, whatever is there. And in this field, this aspect, especially bromelain, which is an enzyme out of the pineapple stem, is quite helpful, which has been shown not only by us, by many people. But most recently, there was a dramatic turn to a more exciting development, which came from Japan, an enzyme which is called serrapeptase, which is produced by Takeda, a very big firm in Japan. And this enzyme is really, this is noteworthy. It's an enzyme which is produced by a bacterium called Serratia 17. And this bacterium lives on silkworms. And when the silkworms touch this Serratia 17 bacterium with its enzyme against the inner side of the silk cocoon, this enzyme melts a hole through the cocoon and the silkworm can escape. An enzyme which first works 10 to 20 hours without getting exhausted, and second, it works against non-vital material like silk, but leaves alone the living tissue, namely the silkworm. And when now we ingest it, comes to the bloodstream, and the Japanese have this on their market, and now we have this Japanese product on the market. Gary, we can do miracles. We can just clean the coronary arteries or the neck arteries here, clogged very often in elderly people. And after about 8 months, they are completely free from any layers and deposits, even very old ones, non-vital material, which cannot be done by the aforementioned bromelain. And this serrapeptase works slowly. You can only take 2 or 3 pills, otherwise you may have a risky intestinal reaction. But it is extremely effective and far more elegant from the doctor's standpoint than is any cutting or burning or whatever. I mean, perhaps you agree. Just recently, again, a special case, a man from here, from New Jersey, he came to see me exactly 1 year ago. Severe coronary disease in the right neck artery, almost entirely clogged. Reports came with him, all the Doppler programs and so forth, and the Doppler results and coronary results. He brought them with himself. So he was put then on this Japanese enzyme and came again just about 3 weeks ago. And he had all this tested about 2 months ago. It's 8 to 10 months after the onset of this therapy. Everything is clean. And then came a very funny report. There were 2 small residues of deposits in the coronaries, and under these balloons, they compressed easily. There's fluffy tissue anymore, never observed before. So especially the neck artery, totally clean. I mean, it's not a miracle, it's just a modern development, Gary, not available in this country. This is not our development, it comes from Japan. Only I brought this substance to an extensive study to clean vessels.
How many Americans could be saved with your therapy?
Gary, the prevention of heart necrosis with the help of these magnesium carriers, maybe the help of a substance which we call carnitine, which burns fat into energy, and with the help of these enzymes which clean the arteries, pipe cleaner for our artery system, we could save, I do not know, 40% of those people who potentially die. It's far more than cancer patients. This is a 48% death rate. Compartment in our death is alone vessel diseases, stroke, clogged arteries, coronary.
How much of the different nutrients do you give?
Of this aforementioned magnesium orotate today, about 1.5 grams a day, 3 tablets, relatively inexpensive. Of the aforementioned carnitine, which burns fat into energy and just cleans all the debris away from inside the heart muscle cell, about 2 grams a day, 3 grams. And these enzymes, especially the serrapeptase from Japan, you cannot give more than 2 to 3 tiny little tablets which contain, I do not know how much they contain, they come this way from Japan. If you give more, you may run the risk to irritate the intestine from the inside, and then we have to stop the therapy. Shouldn't be done. So the Japanese in the prospectus warn not to take it over too long a time. But more wouldn't help more. More time helps more. So tiny doses over a longer time do the job better than higher dose over a shorter time.
Now, according to all the experts I've interviewed, you have a very, very successful treatment for nerve disorders, including multiple sclerosis. Could you explain this to us?
Well, I'm not a neurologist. I'm a pharmacologist at that time when this was developed. And a substance which was first identified here in New York in the late 30s by Dr. Shargaf, a very prominent biochemist, is called cholamine phosphate, or EAP, or 2-aminoethyl phosphate. We just, in short, we say mostly EAP. This substance is a component in all cell membranes. And the cell membrane is a double contoured layer, double skin, tiny, which is electrically loaded and works like a condenser, by the way. And this cholamine phosphate has a position on the outer side of the outer layer of the outer cell membrane, and works there like a nail in a fence, It keeps the structure together, and not only this, it is responsible for the maintaining, for the binding of charge of electrical loads to make the condenser function happen. Now, this EAP was brought to my attention in 1961, and I picked up this substance, same as I did aspartic acid or orotic acid, to use it as a mineral carrier, to make the calcium salt out of it, or the magnesium salt, or the potassium salt, or the lithium salt, and just look what it does. And what it did is, it proved to be a very powerful sealant, a simonizer for the outer cell membranes. And in addition to this, it repaired the electrical function of cell membranes. This is what it does. So it is a repair factor, and this is why we call this substance now vitamin MI, or membrane integrity factor. And it turned out it works, among others, quite well in multiple sclerosis, because in multiple sclerosis the myelin sheath, which is like a multi-layer wrap, like a leaf around a central nerve axis. And what happens there is, normally, that this multi-layer sheet works like a condenser. It has an electrical shunt to the central nerve fiber. Without this, the nerve cell alone would never be powerful enough to make this reaction happen. It can only give the signal, and this pulse then has to be amplified energetically. This is a so-called Tesla system, Nikola Tesla system. Now, when this condenser Tesla system is defective, the energy amplification doesn't work anymore, and then the people, mentally, they are mostly fine. They just cannot move, cannot ignite their mobility anymore. So when we give these substances early enough, before the entire myelin sheath is totally destroyed and decomposed, when we give it early enough, we repair the structural integrity and the functional integrity of this, and then people move better. A retrospective study showed 82% of the patients have improved. So far we have treated about 2,200.
What would you share with the American physicians, people watching this program right now, concerning a proper model for dealing with multiple sclerosis?
The prognosis under standard models is far poorer, somewhere between 30 and 40% of the comparable improvement versus 82%, as was shown in the retrospective study here. There is no other treatment. I mean, immunosuppressive treatment. We suppress the adverse reaction, the so-called immune reaction of the body against these myelin sheath layers. With the help of so-called immunosuppressants, we have in Germany a substance called trophosphamide, Ixotain, which sometimes we combine with this membrane repair factor. By the way, again, the word repair. Modern medicine, to my opinion, should try to repair destroyed function and structure, bring it back to normality, as it has been before. Rejuvenation is the same. Repair what is kaput, what is defective, what is destroyed, and try this to overcome, to prevent, or to heal diseases.
What have you done to share this information with the American physicians and scientists, or even the Arthritis Foundation, or the Heart Association, or the MS Society?
I sent an entire tape to the Institute of Neuroimmunology. This is the immune research of nerve in the National Institute of Health. Dr. McFarlane never got an answer, indirectly only, and to the MS Society here. But I mean, things are better now. We will come together in October, most likely in Florida, and discuss these auspices, because especially since the retrospective study conducted here, and far more work having been done with these factors in other membrane ailments, for instance in diabetes, where it protects the diabetic kidney and diabetic retina very nicely. Scientifically, there is no friction anymore. The problem again is that these factors and medications are not available in this country. That's the main concern. No more the scientific discussion. But by the way, recently I had an American neurologist in my hospital, Dr. Page from Wisconsin, and they tried to start to go into this, make a study in this. Fine.
Have you had any success treating arthritis?
Yes, I mean, of course you can treat arthritis from cortisone to many anti-rheumatic drugs, but based on these membrane repair, we are quite successful. I mean, it's another avenue again to treat disease by repairing defective structures on cells. This also applies to diabetes. This is what I have shown in Los Angeles. These same memory repair factors prevent that in a diabetic, in a sugar disease person, the kidneys would decay or the retina would decay because the blindness, because of so-called diabetic retinopathy, in diabetics is the number 2 cause of blindness in this country. And many diabetic sugar disease people pass away because of kidney failure, as you know. This can be prevented, it can be shown very nicely by protecting membranes which are damaged.
Could you broaden it out? What other conditions have you had success with?
Well, one disease in particular is fibrocystic ailments of the breast. Many women have this. It's not necessarily malignant, but it is a harming and disturbing disease, sometimes painful. And this disease, again, a mineral carrier, calcium LDL aspartate, the calcium salt of aspartic acid, is very helpful to stop the painful reaction in the breast, and more so it seems to prevent malignant cancerous development in those breasts. A study now going on over almost 20 years with some gynecologists, response rate is over 92%, which is statistically seen a total response because you never reach 100% in a biological or model or a medical model.
From your perspective, what's wrong with American medicine?
Gary, it's little what is wrong. American medicine is excellent. Surgery is excellent, diagnostic procedure, imaging, making pictures of diagnostic, of cancer diagnosis, all this world leading, no doubt. What is disputed is the interpretation. What is disease? How has disease to be considered in terms of being different from the normal health state, first, and second, what can we do to react to what we think disease should be? And there, definitely, the orthodox positions do not give the right answer. As a matter of fact, we were so far unsuccessful to bring more health to the people for not more money. More so, those who have reached about 66 years of age, for those, the remaining life expectancy has not very much changed over the last 50 years. So we were so far unsuccessful to bringing more structure or health preservation to the people. Perhaps I make myself clear. And there we have to see that we should get a different approach to what disease is and how we should react to this in terms of internal therapy. In many fields, decalcification, osteoporosis, brittling of bones, clogging of arteries, coronary necrosis, heart attack, cancer. That's the big bulk of diseases. And this, of course, it's the government ruling which retards very much the American position in this field as compared to Europe, for instance, or as compared to Japan.
It's considered that all governmental agencies are bureaucratic, whether they're in Germany or in England or America. But clearly something's different because of the ease at which you can use materials that are simply not available in this country. So what would be the basic difference between your FDA and our FDA?
Oh, we have fortunately far more liberalism. To give you an example, we find a substance, for instance, out of valerian plant from the Himalayas or out of an insect as potentially useful against cancer. then according to the German law, I can immediately make a prescription and tell the pharmacy, do this and this for me, and I can apply it in the patient. I cannot put it on the market. Then I have to go this steeplechase to have this recognized and tested. But I can do this very rapidly. This permits us to see in the patient, not in the guinea pig, in the patient, and the patient is not a guinea pig, very rapidly, is he a merit in this avenue, yes or no? In the United States, it would take me 10 years. I don't live that long to investigate 10 or 20 or 30 different avenues of approaches to treat cancer this way, always wait 10 years. That's the problem.
Do you keep abreast of all the other therapies? Do you incorporate them into your own, or do you just work with what you discover?
No, no. I mean, conventional therapy remains state of the art. If this is cancer therapy, or digitalers in the heart patient, or cortisones to block
But these are not curative, and they're frequently toxic.
That's what the point is. They just repair force. They improve the symptoms for a certain while, but of course very often we have to use those. But they don't get us very far. That's why I sit here. This does not say that we do not perform chemotherapy, surgery, radiation, coronary surgery, other surgeries, breast removal. All what is known in the scientific and the medical community, we take into account. But unfortunately, it doesn't get us far enough, or the patient far enough, which is well known.
Have you gained acceptance of your work?
I mean, there's always friction and discussion. And I like this. I like the discussion and the opponents and the steeplechases to mature, to filter out the truth and so forth. But I have been the president of the German Society of Oncology for 3 years. I had just recently my 60th birthday, and for that occasion, the journal Space and Time, Raum und Zeit, which I have founded for both medicine and space physics, I'm also in space physics is my hobby, became, for the occasion of my 60th birthday, the corresponding journal of the Soviet Academy of Sciences. The cancer congresses, which I had presided for many years, count about 500 to 600, which for the United States standard would be about 2,000. Constantly doctors call me. What do you think? You ask for consulting. Constantly doctors want to come as visitors, not only Americans out of Germany. Then, most importantly, Bertelsmann, one of the biggest media concerns in the world, also has made acquisition here in this country of RCA, of Doubleday, and of Bantam, for instance. Just has been shooting a program with me over a year and a half, almost 1 million mark enterprise, discussing new metabolic medicine, means medicine in which therapy, in contrast to toxic substances, we bring in substances which are normal to the organism, can be metabolized, will not be toxic, can be given for indefinite time. That's what we have been talking about. Gary, this was on the air on the 3rd of January. It was the most successful program in the history of German TV, with 5 to 7% of letters with respect to the viewership. This was regional and will be all over Central Europe on the 21st of August, a Sunday evening. I mean, accepted or not accepted, we cannot do more. I cannot do more. That's absolutely impossible.
What kind of link is there in the scientific community to get your work accepted here?
It is not my business, not my concern to motivate FDA, the AMA, or whomever to come to different positions. In Germany, the development is very easy to explain. The health cost is exploding so dramatically that no one can pay for this anymore. Without that, more health is gained. So in order to get more health for not more money, or more health for less money, we have to go to different avenues. That was also the topic of this film, by the way. And I mean, orthodoxy will phase out because no one can pay for this. It will be historical development. If they recognize me or not, or friends of mine, or the concept of mine or not, I couldn't care less. By the way, our customers are the patients, and they vote with their heels, not the AMA or the FDA. It's the patient, it's the people. Glasnost and perestroika has to come also to this country in the medical field. Saying so.
How many doctors in Germany refer patients to you, are familiar with your work, or accept your work, or try to duplicate your work?
It's very easy. We have about 200,000 doctors in Germany, and out of those about 75,000 are working individually, not in hospitals or not only self-employed. And out of those about 30% follow in general about that avenue I'm leading, let's say, about 30%, and every year getting more. The congresses in this field explode, whereas the others in Orthodox medicine just dry away. But can we do more? Who can handle that?
With all that you've done, with all the obstacles that you have hurdled, where do you go with your life from here?
From very easy, we have a program starting where we program certain plants, the chromosomes of plants, to specifically produce killing factors against cancer cells, against human cancer cells, which we call adaptive gene engineering or adaptive gene research. Not engineering, but adaptive. When such a system like the chromosomes derail, you cannot hire 10,000 chemists to work for 20 years. You cannot pay for this. Certain plants will do the same job within a week with their genetic system.
Okay. Thank you very much, Dr.
Thank you.
I'm Gary Null, a very remarkable man. And it's about time that if our government's not going to do something, we take it upon ourselves to become as educated and aware of those therapies, no matter how they're looked upon, that could be changing our lives, improving it and saving it. Until next week, I'm Gary Null. Stay healthy and stay well.